Hello everyone, I'm Shakila. I'm one of the Amazon FNP students. I am going to work on my presentation today on special population in our society. I am going to focus on the elderly or the geriatric group of population. Globally, the population is aging rapidly. In between 2015 to 2050, the proportion of world's population over 60 years will be nearly double, which is about from 12% to 22%. The expected number of population will be from 900 million to about 2 billion. Older population face some special physical and mental health challenges which need to be recognized as mental health and emotional well-being, which are as important as physical health. Sometimes as people age, they may lose close connections with friends or family. Or they may still feel lonely even when they're surrounded by family. Some may feel a loss of purpose as they can no longer complete tasks like work or driving, which they did in their younger years. The loss of a spouse may also trigger depression and cause a person to be withdrawn from activities once they enjoyed before. Elderly people are more likely to experience adverse effects of unhealthy emotional status, which in turn affect their physical health as well. Assessing the mental health needs of this population group require an understanding of complex interaction between specific medical conditions and social circumstances. The estimated annual healthcare costs of depression, anxiety, and other comorbidities reach up to 100 million per 1 million population of elderly group. The most common mental disorder in this age group is depression, which affect about 7% of the world's elderly population. Additionally, anxiety affects about 3.8% of these older people, and about 1% people led to the habit of using various harmful substances. The huge percentage of death from using substance in these people sometimes get overlooked. As a healthcare provider, it is very important to assess some screening for all these mental conditions in elderly population. Some of the tools that we can use for the screening is the PHQ-9 assessment for depression, especially the geriatric depression scale, the alcohol use disorder identification test, and the mini mental state examination. These assessment findings will be helping while someone is planning of treatment of cognitive impairment, which may need focus on one or more signs and symptoms, including cognition capacity, quality of life, mood, and behavioral impairments. When evaluating elderly patients, it is important to assess cognitive status and determine their baseline ability to function and perform activities of daily living. Having a baseline for a patient's activity of daily living status, which allows the provider to quickly recognize and act upon changes. The geriatric depression scale can be used to screen for symptoms of major depression in elderly patients with apathy, lethargy, or low mood. They should be evaluated for delirium as well, where the confusion assessment method is a short 4 questions screening tool that can be useful in detecting delirium. The hallmark sign of delirium is the presence of an underlying medical disorder, such as an urinary tract infection. So it is imperative to discover the cause and then initiate appropriate treatment. Dementia is an illness estimated to affect 5% of people between the ages of 71 and 80 years and more than 37% of people over the age of 90 years in the United States. Once cognitive impairment is suspected, screening can be undertaken using the full scene mini mental state examination or the memory impairment screen. Several pharmacological and non-pharmacological interventions have been introduced to prevent, slow, or reverse the cognitive impairment, which eventually stabilize or improve functional performance and improve caregiver burden or depression. The clinician decision-making include cognitive training, rehabilitation, stimulation interventions, exercise, peer support, psychological education, and care management. The mental health of all the adult can be improved through promoting active and healthy aging. Mental health promotion also depends on living conditions and environments that support well-being and allow people to lead a healthy life. This promotion strategy used to ensure that other people have the necessary resources to meet their needs, such as providing security and freedom, adequate housing through supporting household policy, social support for other people and their caregivers. Health and social problems target vulnerable groups such as those who live alone and rural population or who suffer from a mental or physical illness. Programs to prevent and deal with substance abuse include community development programs for prompt recognition and treatment of mental status and substance use disorder and others. Although elderly people need both psychosocial intervention and medicines. Community level primary mental health care for all the people is important as it is equally important to focus on the long-term care of others suffering from mental disorder as well as to provide caregiver about appropriate education, training, and support with appropriate and supported environment-based human rights. Standard and required treatment protocol should be implemented to ensure the highest quality of service to people with mental illness and their caregiver. Though therapy or counseling is recommended as first-line treatment for depression, it is often underutilized for a variety of reasons, including transportation, social stigma, or lack of available providers. Subsequently, most patients with depression elect pharmacotherapy or considered as one of the first-line treatments for critical depressive disorder. In order to do the better tolerability, easy use, and general safety, especially overdose like centrally potential side effects should be monitored and dosed accordingly. SSRIs are the most recommended drug class for the elderly population based on efficacy and less interference with other medications and less sedating effects. Other types of antidepressants should be started in low and titrated up as necessary in the elderly population. Cholinesterase inhibitors and memantine have demonstrated statistically significant improvements in cognitive functioning in patients with dementia. I focused on the presentation about the elderly or geriatric population, but I also made all the slides regarding the perinatal or lactating population as well as the LGBTQ or migrant population. So please help yourself to enjoy my slides and let me know if you have any question. Thank you so much.